Good evening, everybody. Welcome to Pull Up with Limbs and Things. My name is Dr. Chanel James, and I am the owner of Limbs and Things mobile and telehealth practice in Washington, D.C., Maryland, and Virginia, serving aging adults. Tonight, we have Mr. Chris Phillips. He is with Medicare Portal, and we're going to talk tonight a little bit about Medicare, answering some of your questions, hopefully bridging the gap between some things that we don't know, challenging some of the things that we do know, and then being able to share that information with someone else. So with physical therapy, we tend to bill and know how to bill fine. But then once you become a business owner, you don't know all of the ins and outs of Medicare. And so I found Medicare Portal, had a conversation with John Norris, and then got introduced to Mr. Phillips. And so we are having this conversation tonight to hopefully answer some of the questions that some patients bring to us about if I have Medicare, do I have original Medicare? And because I take Medicare Part B, I have to answer some of those questions. And so I wanted to bring you on tonight to answer some of the questions we have. So if you have a question, please put it in the chat and we'll answer them as best we can. Thank you so much for joining us, Mr. Phillips. Floor
Thank
is
you for
yours.
having, thank you for
Yeah.
having me. Again, Chris Phillips from Medicare Portal, and I'm very happy to be here. A little bit about Medicare Portal. We're in North Virginia, so we serve the whole metropolitan area, and it's no cost. What we do is we try to help you to understand your Medicare benefits, how to enroll. And if you ask, well, how do you get paid? Well, if we are fortunate enough to help you enroll, then the carriers that you enroll in will then give us a commission, basically. So I guess we want to start off with really quick, and we want to do this like a conversation.
That's right.
So if you guys have any questions or anything, just feel free to ask. But Medicare, for the most part, is your federal entitlement. You've been paying into it. You generally qualify for Medicare is what they would say is 40 quarters. So if you worked and you paid taxes for what is 40 quarters is equivalent to 10 years. So full-time employment for 10 years paying taxes, your Medicare taxes, generally you will qualify for Medicare A and B. Now, the thing you need to know about A, there's no premium for A. Once you qualify for A, it is no cost to you. However, Part B is a cost. And in 2021, that cost is $148.50. Now, that's depending on your income. If you've done well in your retirement budgeting and your income is pretty high, you may pay more than that. But if you have low income and you're getting public health, then you may not pay that at all. And so that's some of the things that we want to look into when we're talking with you, and we want to evaluate and do what they call needs-based analysis for you personally to see what will best plan, best fits you that you can take advantage of.
Sounds
All
good.
right.
So tell me a little bit about who can get Medicare in general, because a lot of us think that we have to be a certain age to get it, but there could be some other qualifying conditions, right?
That's right. So folks that receive Medicare, uh, of course, when you age in, that's the month that you turn 65. So if you turn 65 in July the 12th or July the 1st of that year, you are eligible to receive your Medicare. So also people with disabilities. So if you're qualified disabled through Social Security, SSI, for
Mhm.
24 months, then they can move you on to Medicare. There are some stipulations as if they'll do that now, because I met so many people that's been on disability SSI for way long, 24 months, and they don't have
Right.
Medicare. But for the most part, that's one of the determining factors. And the other thing is people with end-stage renal disease. So if you're on dialysis, end-stage renal disease is stage 4. That's someone basically on dialysis, where they're looking to be on dialysis or they have to have a kidney transplant. Then those folks are eligible to go on Medicare also.
Is it only kidney transplants, or can they be on have another disability as well?
No, right now it's kidney transplant. If they have another
Okay.
disability, then they qualify for disability, then they would go on for that. But
Okay.
right now, as far as I know, it's just kidneys.
Gotcha. Okay. Because I thought that was interesting because I have a patient in his 30s and I have a patient in his 90s, and they both have Medicare B. So I thought that was
Okay.
interesting to mention.
Yeah. So I actually have a fella right now. I signed him up when he was 26. You know, and he had full Medicare along with some what they call extra help, which is partial Medicaid, but he actually had full Medicaid. So that's the case.
Gotcha. Okay. So we have a question over here. What's the difference between Medicare and Medicaid?
Okay, Medicare is your health for entitlement for folks that paid into it, and they also receive what we just discussed. Medicaid is actually a federal state program for low income. So right now, if your income is below the federal poverty level, which is like $14,000 or something like that, then you could qualify for Medicaid
Okay.
or partial Medicaid. So some folks, they don't meet the that they make a little bit more than that, but then they end up getting partial Medicaid, and then you might hear something called a spin down, where there's some folks make over that amount, but because of their bills and everything, once they spend that money, down that put them into Medicaid, full
Yeah.
Medicaid. And if you know someone that has Medicare and Medicaid, and they could very well qualify for a very substantial plan. The benefits is really great if for those folks that have Medicare and full Medicaid. So anyone that has that, they really need to look into those benefits that they could receive at no cost to them.
Right. And so they need to contact Medicare Portal to find that out, right?
Oh, please contact Medicare Portal. You can contact me directly if you like, but
All
yeah,
right.
Medicare Portal, we're there to help.
Okay. Another question for you. A lot of us think Medicare is alphabet soup with parts A, B, C, and D. So there's a question here too, going toward that. What's the difference? Let's break down all of them. A, B, part C, and part D as well.
Okay, so original Medicare is Part A and Part B. And the A stands for your hospitalization. So if you're admitted in a hospital, your Part A of your Medicare benefits will take over. When you go see your doctor and you're doing your physical and your MRIs and all your blood work and things like that, that's all Part B. Okay. So that's Part A, that's Part B. Now, Part C is when you see when you're watching television and you hear about those plans that what's their quarterback, Joe Namath, is talking about, and say you could get this, 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 and this. They're really talking about a Medicare Part C or Medicare Advantage. So Medicare Advantage and Medicare Part C is the same thing. They just call one, you just different names, right? Nomenclature. So that's an all-in-one plan. So what they do is they wrap your A, your B, and your drugs in a Medicare Advantage plan, and then you also have some ancillary benefits, like you might have some dental, some vision, some hearing. You might have transportation, and some over-the-counter benefits, all wrapped up in this one plan, and that's a Medicare Advantage or Medicare Part C plan. And D is for drugs, so that kind of be easy. So some folks that have just original Medicare A and B, they also need drugs. So you can have original Medicare A and B, and then you can also have a standalone or separate plan just for your drugs called a standalone drug plan. Those folks generally, at most times, they also have what is called a supplement or Medigap. So if you hear Medicare supplement or you hear Medigap, that's talking about a plan of Medicare that's A that covers what Medicare doesn't. That doesn't cover. It covers A and B that Medicare covers, but it doesn't have dental and vision and all that
Okay.
with it.
So that's like, so for me, from my point of view, I see people that have Medicare B and it'll cover 80% of PT services, but then they
That's right.
have a supplemental plan that can cover their 20% left. Is
That's
that
right.
what you mean? Okay.
That's right. So that's the way to go original Medicare. So the way that works is just like you said, Doc. When they see you, they give you your Medicare card, and they give you their supplement card, because the Medicare, you can look at it as their primary, and
Right.
then the supplement or the Medigap would be covering with that first plan what Medicare doesn't cover, right?
Okay.
So
Right.
with that, they will also need to have uh, dental if they want dental, and they also need to have their separate drug plan in order to be fully covered under the Medicare original way. Now, again, with the Medicare Part C, it's just like all in one, okay? Uh, So yeah, so that pretty much covers that.
Okay. So then with Medicare Part C, these Advantage plans, I think we should talk about it a little more, right?
Sure.
There's some people who have United Healthcare or Kaiser or Blue Cross Blue Shield that covers their Medicare. Is that an Advantage plan?
Yes, that can be an advantage plan. So Medicare, is the A and B, that's federal. Okay, so you're dealing with the government when you're talking about your Medicare. But
Mm-hmm.
when all the supplemental plans are all private companies. So the government takes care of the Medicare, the first 8%. If you're going to get something to supplement that, then that's going to be all private companies. So when you talk about the Medigap plans, then you're looking at carriers like United Healthcare, Aetna, Anthem, Blue Cross, you name it, right? And then when you're talking about the Medicare Part C, you're talking about the same companies that could also offer those Medicare Part C plans.
Mm-hmm. Well, that's good to know. Yeah.
Yeah.
Okay. Is there anything else specific to what you do at Medicare Portal that you want to share?
Well, what we do at Medicare Portal, if you want to go to MedicarePortal.org, that's www.medicareportal.org, you can see a whole host of things that we want to help you with. So if you have any questions, we are really trying to be your one-stop shop. We really want to take the stress off of you. Matter of fact, our cause, what we use as our motto is to no more, stress less with Medicare Portal. And then that's what we do. And again, it's no cost to you, and then we were very much, and so we don't have a as they said, we don't have a dog in the fight. What we really want to do is find out what your needs are, what your requirements are, and then we can explain to you what your options are. And once we do that, we can help navigate you to choose the plan that's actually best for you, where you can get the most benefit out
Got it. Okay. Here's another question. It says, do you see Medicare always being here just because a lot of taxpayers don't like it?
of it. A lot of plans don't like it. So taxpayers don't like.
Mm-hmm.
Well, I don't really know anyone that don't like Medicare. I know the politicians like to talk about how that it is costing, what it's doing to the deficit, and how expensive it is. And I kind of blame that on them actually, because they're the one that kept moving money around, taking money from here that they shouldn't, and now they want to blame it, on the aging population. But yeah, I do see it being here quite a while. I just don't see, and with the cost of healthcare being the way it is, it's pretty devastating now. I cannot imagine what it would be like if Medicare somehow evaporated. In fact, under the current administration, the Biden administration, they're starting to look at probably enhancing Medicare by lowering the age limit. So I just heard one senator apologize just the other day, saying that because of the infighting, that they're looking that maybe that push lowering the age of Medicare to 60. That would be pretty tremendous, for a lot of folks, because
Right.
Medicare really is quite affordable compared to what else is out there. So when we talk about those Medicare Advantage plans, imagine this. If you go on to the health.org, or you just got your employer coverage, you might pay, I know folks are paying $1,200 a month for themselves,
Yeah.
right? $1,200 a month. And that's what their employer making donations or contributions towards it. I can take that plan and compare it to a Medicare plan that costs $19. And the Medicare plan will actually be more valuable, will have more value to it than the
Mm,
plan that the employer plan is. So yeah, so I think that it's necessary that we keep Medicare. Without it, I think so many folks will fall by the wayside. I think it'll just have just such a negative, that devastating effect on our
for sure.
communities.
Yeah. Okay. What would you say for a provider who is trying to decide if they should accept Medicare or not?
Well, if I was talking to you, Dr. James, I said I want you to see if you can contract with in Washington D.C. United Healthcare has what they call a dual special needs plan, and this is dual is for people that have both Medicare and Medicaid that we talked about a little bit earlier. So they
Right.
have both. They have full Medicare and full Medicaid. That plan actually pays commercial rates. It doesn't pay Medicare rates. So
That's interesting. Okay.
yeah. So what you have now is people who are low income who probably have been going so long without seeing a doctor and doing their physical therapy and getting their regular checkups, now having a plan that will pay you and they don't have to pay anything. So not
Hmm.
only will it increase your visibility and allow you to help more people, but it also allows more people to get the health care that they need.
Right.
It's pretty incredible. So I would recommend you tell all your provider friends that if they take Medicare, to look at maybe contracting with for the dual special needs plan, because it really is incredible. Let me do, for example, in Virginia, that plan pays commercial rates for dental, and it gives their members $3,000 a year. Now, if you know anything about dental care, dental insurance, that you know that a plan of $2,000 is generally the highest most folks ever seen. And that's
Right.
pretty much what we're used to. But now they're giving plans that even as much as $3,000. So, and we know that oral health is one of the first indications of disease in the body. So we can keep the mouth clean, then we
Right.
can we on the step. So the mouth and the gut, that's the two things we want to make sure we get. And so these plans are really geared to help give the people those benefits for that. In addition to that, they don't want them to go without. So they have this thing called over the counter benefits.
Mhm.
So over the counter benefits are benefits that you find on the shelves at the CVS, the
Right.
Walgreens, Walmart. So these plans will give them as much as $2,000 a year on a debit card, where they can actually walk into the Walmart or the CVS. It's $500 a quarter. So every three
Right.
months they have $500 added to this debit card, and it rolls over. So that's to say, if they don't use it by the end of the year, they have $2,000 sitting there that they have to figure out what to do. So they wanted to get that Oral-B toothbrush. They want them to get a scale if they need. They want them to get the lotions and the water picks and all that, and they can also help get vitamins and things like that. So they're doing everything they can to assure that people have access to receive the best care that they can.
Tell us what that's called again.
Well, that's that plan that's called the dual special needs plan. So
Dual
they have
special.
both Medicare and Medicaid. And
Okay.
if someone qualifies for that, and if you know someone who qualifies for that,
And I lose you. See if I can bring him back. I see you guys have a few questions. Thanks for joining us. Okay, I see your question over here. Is Part C income based? He's coming back. I'm gonna let him answer that one. But if you have Medicare or if you have Medicaid, you want to definitely put your question in the chat. We will answer them as best we can. Mr. Phillips is joining us soon. He's getting his
I'm
Wi-Fi.
back.
You're here.
Yeah,
Okay, there we
I'm
go.
sorry, but I
Wonderful.
have no idea. That's one of them gremlins that we had to learn about here in the 2020.
Yep,
It's
it's
just
quite all
2020.
right. So
My
here's a
apologies.
question for you. Oh, you're fine. Is Part C income based?
No, Ponzi is not income based, and neither is it underwriting based. So regardless of your medical conditions, you will qualify for Part B at the same Part C at the same rate as everyone else. So
Good to
whatever
know.
plan, but it is zip code. It is zip code. So based on your zip code depends on what plans are available to you,
Right.
right? So the
Mhm.
thing about Part C, so when we talk about original Medicare A and B, and then you get the Medigap, that means that you can go to anywhere in the country. And I always tell a story that I had a member of mine. Hey, she had some type of serious eczema, and it's been troubling her for years, as you can probably imagine. And there was a trial in Arizona, and she called me up and said, "I heard about this trial. You think I can go?" And I said, "Listen, you ask them if they take Medicare. If they take Medicare, they take Medigap and the supplement to go along with it. That's not the same thing with Medicare Part C. So with Medicare Part C, one of the reasons why it's so affordable is that it's network based. So the providers are going to be able to control the cost based on the network. So all the doctors in the network agree to certain payments. So the
Right.
facility doctors, and they can control costs better, and that's why they was able to reduce the premium for those plans, and then add in all those ancillary benefits also.
Gotcha. Okay. Thank you. Is having a licensed Medicare insurance agent required to get Medicare, or can anyone get Medicare by themselves?
Anyone can do it by themselves. So Medicare.gov is the federal site. If you go to Medicare.gov, you can do all your research, and then you can even see how to enroll and what you need to do, and you can see all the plans. You put your zip code in, you can actually register, and get, to get updates and things that's changes in your zip code, and you can get to see what's available in your zip code as far as plans, Medicare plans.
Okay. What's the benefit of having an insurance agent help you out?
Well, first of all, it doesn't cost you anything. It's going to cost you the same thing with your insurance agent if you do it yourself. So you
Okay.
can do all the research yourself, but then how sure are you that you're not maybe overlooking something? How sure are you that you're looking at something explained to you the right way? So as an insurance agent, and one of the beautiful things about Medicare that you want to also know, so you can take the anxiety out of it, is that if you buy a Medicare Part C plan from United Healthcare, Aetna, no matter which plan you buy, the government says that that plan pays this much commission. So there's no advantage for an insurance agent to say, hey, I want you to take this plan over this plan,
Hmm.
because it's just not, it's going to pay the same. So where's the benefit? The benefit is in customer service to make you happy, right? So what we're going to do, again, needs-based analysis. I've got some questions I want to ask. I got to learn a little bit about you, what are you going through? And then when we do that, then we'll be able to pick a plan that's available to you, and then you'll be able to see the options that are available to you. And then you may be able to say, you know, you have a clear choice.
Like it. I think that's valuable too. Even from a PT standpoint, we can do our Google searches, but the expertise that someone has having that background is what makes the difference.
Oh yeah, it's I think it's phenomenal. I mean, we at Medicare Portal, I recognize me and my colleagues. We just kind of get excited about trying to help folks.
Yeah.
Actually, I know we don't have time, but I was just really quick. I met a young lady. She was about 83 years old, and
Mhm.
she was paying about little over $400 a month for her Medicare costs, just the premiums, not the drugs, just the premiums.
Mhm.
And she called me up and said, I need help. She said, I'm only making $1,400, on a fixed income, only $1,400 a month. And this is what I'm paying. And I was able to find her a plan that was going to be for $0, right? A $0 plan that would
Yeah.
provide her with all the benefits, the same doctors, her doctors in network and everything. Now, she did have to give up the idea. So she did give up the plan that she can go to any doctor she wants. But the plan doctors that she had was already in this plan, right? So you can imagine how elated I feel to be able to help someone to save
Right.
$4,800 a year when they're already on a fixed income like that. Yeah,
Let alone how she feels, right?
right.
Got it.
She,
Okay.
of course, she didn't believe me at first. you know,
You got to see it to believe it.
yeah, you got to see it.
Yeah. Okay. Is there anybody else that has a question? I just want to give you enough time to ask. I do see you are joining us, and we thank you. Another thing from my perspective too with PT is we tend to have people who just don't know if they have original Medicare or an Advantage plan. So, is there a difference in the cards that you receive?
Yeah. So
Okay.
if when they have original Medicare, they'll have their red, white, and blue card. It says Medicare A and B and a new MBI number on it. You should no longer have your Social Security on it. They have a
Right.
new MBI number as of 2019. So they have that card they need to bring to you. They will also need to have their drug card if you prescribe to provider that prescribe drugs, right?
Hmm.
And if they have a supplement, they will also have their supplement card, right? And if they have dental vision, they will have probably a dental vision card. So with the Medicare, original Medicare, they should have more than one card. They'll have like a deck of cards, basically. But with a Medicare Advantage, all those cards will roll into one. And it
Okay.
should be a carrier card. So if they come in, they should have a card from United Healthcare, from Care First, Anthem, or whatever, whoever they have. They'll have a card with, and it'll have a member ID number on it with that carrier, and it should also have their, more likely, it would have their primary care physician on the
Okay. That's good to know from a provider standpoint as well too, because a lot of people think, yes, I have Medicare, but the Advantage plans are actually a little bit different than the original Medicare. So thank you for clarifying that. Is there anything else that you think is beneficial to have or to know from a Medicare standpoint from your perspective?
call. Yeah. So what you want to know is that in October they do what they call an ANOC. That's an annual notice of change. So all Medicare Part C plans and and Medicare plans are going to have an annual notice of change every year. That they will send that out to let you know your premium is going up, your premium is going down. We're adding this, we're taking this away. So that's something that everyone should be on the lookout for. And that should be, they should receive that sometime in September to October, right? October 1st. Annual enrollment period. Every year from October the 15th to December the 7th, you are eligible to look into what plans you can change to. You can make any change you want as many times as you want from October the 15th to December the 7th. So on October 15th, if you decide to enroll in the plan, and you said, man, I love that plan. But on December 7th, you find out there was another plan that you even like better. You can actually roll into it again. Roll in it again. Okay, so you don't have to fear about making a choice and then find out later on. It's not a one-time thing. So that's what we want to do every year. We want you to be able to tell your age. And that's the thing we do at Medicare Portal. We want you to be able to know that we're there for you. And once a year, we want you to tell us, is any drug change? Well, let's find out if the plan you have is actually the best plan that's going to take care of those prescription drugs that you have. Any changes you have over the year, we want to be able to follow up with you to see if there's any changes that will benefit you even more. That's one of the great things about having an insurance agent, is because we are always required to do continual education and to keep up on what's changing in the field and then pass that along, of course.
Right. Wonderful. Okay. Here's another question. Are you only able to help those who are 65 and older get insurance? Since it's 3 of them, let's do one at a time.
Okay. No, so I'm basically a Medicare agent. I do offer some other types of insurance, but basically it's all wrapped around how I can help my Medicare members. And so if you're about to turn 65, I say when you turn 64 and a half at the least, you should be reaching out to find out what your options are going to be. You want to get in because you and then, but if someone is under 65 and they are disabled and they are on Medicare, then we can also help them with their supplemental insurance.
Okay. Do you assess those who have Medicare now to see if they have the best plan?
Absolutely. That's one of the things we like to offer. So we talk, we'll sit down, we'll talk and say, okay, what do you have now? Let's look at that. We'll look at your zip code, or we'll look at the, what's available to you where you are. And then we'll be able to tell you what your options are.
Okay. And then the last one of this one is, which coverage is best for prescription? I think we talked about Part D, but you can answer it further.
Okay. So prescription drug costs is changed based on the plan that the person has. So each plan has its own unique formula, and that's the list of drugs and their tiers. So when you start talking about prescription drugs, you can get really, you can really get involved into it. Mm-hmm. So to know what best plan for someone with prescription drugs is, we actually have to know those particular drugs. So we'll take your particular drugs, put it in a particular computer-based system to see what comes up and what plans are then shown to be best for that. So we know what best, and again, to know what best prescription drug plan for you, we actually need to know your prescriptions.
Got it. So you customize it for the person.
Yeah, we have to do that.
Yep. Okay. Sounds good. I've enjoyed talking to you. I think I've learned a lot more than I knew before. So I thank you so much for your expertise and sharing that with us. Do you have a final thought you want to leave with us tonight?
Again, I'd just like to say, give Medicare Portal a try, www.medicareportal.org, and I think you'd be very satisfied. I think you'd be delighted, actually.
I do too. I think that it is definitely beneficial, not just for consumers, but also for providers as well, to learn as much as we can about Medicare so that we all can be educated, and not just from the standpoint of keeping the information to ourselves, but to share it with someone else.
Yes, yes.
So I thank you so much. If you have, I think I answered everybody's question. Mr. Phillips, if you are on Facebook and you see any questions, feel free to answer those, and I will put Medicare Portal's website on the comments so that everybody can contact you.
All right. Sounds great. Thank you much.
All right. Thank you so much for joining us. Everybody have a good night.
All right. Good night, everybody.
Bye-bye.
Bye-bye.